Hey guys, welcome back to another video. Today we're going to talk about Clover Health. I want to update you on some things that are happening with the company. Number one, we're going to talk about what Clover Health is offering in their new 2022 Medicare Advantage plans. That's going to be important as open enrollment starts next week and will continue on for a few weeks. That'll make a big difference in trying to attract new patients to Clover Health. Number two, we're going to talk about their expansion. They're expanding into a whole bunch of counties for 2022, so we'll talk about the details of that. And number three, the Medicare star ratings were released this last Friday. We'll talk about Clover Health's ratings and how they're doing and where they might be able to improve to get that star rating up just a little bit more for next year. All right, first of all, let's talk about the Medicare Advantage plans for 2022. So Clover has just added two new benefits for their members. For 2022, they've added the Eat Better with their Grocery Plus benefit. Now, there are some things you have to do to qualify for that. But if you do qualify, well, then you can get things such as fresh fruits and vegetables, frozen meals, all of those things listed there. The other benefit that they've added, they're calling the Save Money with Insulin Savings Program. That's designed to help members pay a lower amount out of their pocket for select insulins without a deductible, essentially making it as low as $25 a month and saving them almost $450 a year. Let's go to item number two, and that is the expansion of Clover Health into numerous counties within the United States. In fact, they're expanding into 101 new counties. They are expanding into one new state, Alabama. That'll bring the total number of the counties that they offer their services in to 209, so you can see that they're almost doubling the number of counties that they had for 2021. When it's all said and done, their coverage map will look like this. All right, lastly, I want to talk about the star rating that Clover Health received from CMS just yesterday. Now, this is going to take a little bit longer than the first two topics. I have delved into the information that CMS has released, reading through how they went through some of their scoring and looking to see where Clover Health can do better. So let's talk about this. First of all, what you have before you here is a spreadsheet that was released by CMS. Now, it has all of the Medicare Advantage contracts. I specifically looked for Clover Health, and then I have expanded that particular row so that we can see it better. So this first spreadsheet in the workbook will give us the percentages that they used or other values that they used to grade each individual health plan. Specifically, we're going to cover the ones for Clover. Now, it's interesting when you look into some of these, you might see a score that you think doesn't look particularly well, but remember that these get graded against the other health plans. So in some cases, a score of 68%, for instance, on the annual flu vaccine, that is going to look very low. It's only going to get 2 stars when we get to the stars. But in other cases, when we see 68% for osteoporosis management, they're going to do much better and get 4 stars. So now what I've done here is brought these two spreadsheets within this workbook up side by side so that we can see the percentages and we can also see what the star rating is. Now, for instance, breast cancer screening, 67%, and they get a 3. When it comes to colorectal cancer screening, they do slightly better percentages, but they get a 4. So where can Clover do better? All right, annual flu vaccine. This is an easy one. This is so easy. You can get a flu vaccine just about anywhere now, and there's no really good reason why that shouldn't be 100% unless their patients just don't want to get a flu vaccine, which certainly there are some people that don't. So to me, this seems like an easy place for them to improve one of their stars here. Let's just turn to customer service. This is an area where they got a 2. Now, when we look at the raw score, we see it's 89. 89, usually that's a B+, almost getting close to an A-. But in this case, they are performing worse than most of their competitors, and thus they only get a 2 here. So this is something that if they bring it up just a little bit, they can bring this star rating up. What am I talking about? If we go into the customer service metric provided by CMS, we can see that here they are at 88 to less than 90, so 89, so they get a 2. If they can get this up to 90, they're going to get a 3 star, and if they get it up to 91, they're in the 4-star group. So just going up 2 on the metric is going to get them up to 4 stars. That to me seems like a no-brainer. How did they get this metric? Well, they did it by asking members how easy it was to get the help or information that they wanted when they needed it. Now, here's another place where they can try to improve, and that is medication adherence for cholesterol. Those are the statin medications, and they got a 2-star on that. If we look over at the percentage, it's 81%. Now, the metric for this is just checking to see how often the members refill their medications often enough to cover 80% or more of the time that they're supposed to be taking the medication. Solving this might be as simple as sending them a text or giving them a phone call or sending them a letter in the mail to remind them to refill their prescription medication. Now let's just look at a few areas where Clover is doing really well, where they're getting 4 stars or 5 stars. And how does this show how well they're doing at their business? Now here's one that I think is the bellwether, complaints about the plan, 0.29. This is the number of patients per 1,000 who have complaints about the plan. So we see that that is a very nice low number. We come over here to the star rating for complaints about the plan, and they get 5 stars. I think that is a key indicator here. What else? Members choosing to leave the plan. Now, 13%, in this case, you want to have a lower number. 13%, that gets them a 4-star on the CMS rating. Let's come over to complaints about the drug plan. That is the Part D plan of this Medicare Advantage, and that is 0.29. We come over here to their star rating, and we see that it is also a 5. So people are happy with the plan. They're not complaining about it, and they're also not complaining about the drug plan. And when we hit their overall ratings, we'll see that they get a 3.5 for Medicare Part C. We'll see that they get a 3.5 for the Part D drug portion, and overall 3.5. So we learn here that if they want to get up to 4, they just need to do this staying healthy screenings and tests and vaccines like the flu vaccine that we talked about. And the member experience, if they get their customer service up, I think they're going to be able to get this up to a 4. And then, of course, if they can just raise the drug safety and accuracy of drug pricing, that's really the thing that's drawing down on their drug plan. They can get that up to a 4 as well. So overall, I think that Clover Health is doing better. They certainly have raised themselves from 3 to 3.5. So where does that put them in comparison to other plans? So this is for Medicare Advantage plans that also offer Part D. And we'll see that 3.5 stars is going to put them actually in the bottom half when it comes to percent of the contracts. But when it comes to weighted by enrollment, they're actually in the bottom 10%. So they have some room to make improvement here. And we've seen that with just a few improvements, they can get themselves up into the 4-star range for next year. Now, one more thing that may actually help Clover in the star ratings for next year is whether the details of this report are adopted for next year. This report goes over some of the social risk factors that go into Medicare's star rating and how companies that are serving a higher population at risk may end up with lower star ratings. So that's going to do it on the update for Clover Health. As always, share this information with a young person in your life, and until next time, enjoy your investing.